So once you identify those three major muscle groups, you can begin to identify certain causes of lower back pain. If you have weak or overdeveloped abs, you can cause the curve in your lumbar spine to become flattened or to become over-exaggerated. For example, if my abs are underdeveloped and they're too weak, I'm going to stand like this with an exaggerated curve in my lumbar spine. And that's going to cause compression in my lower back and eventually postural damage, basically. And the other thing is, if my abs are overdeveloped, it's going to cause the opposite tilt of my pelvis, which is also going to, over time, damage my body and cause chronic pain. Another cause is if the hamstrings are too tight, because they run from the sitting bones, the little 2 points at the bottom of the pelvis. They run from those bones and they attach to the tibia. If they're too tight, again, they're going to cause that posterior tilt in the pelvis. And eventually, over time, they're going to do permanent damage. Those are major muscular causes. There are other causes that involve having a herniated disc or the sacrum, the triangular shaped bone that sits at the bottom of the spine. It can be not sitting correctly. It can be tipped to one side. It can be twisted, again, in that anterior or posterior tilt. Anterior meaning tilted forward, posterior meaning tilted backward. So if your sacrum isn't sitting straight, of course, that's going to cause pain. And if you have a bulging or herniated disc, which means that your discs are compressed or are laterally askew, you have some sort of subluxation, which is not a dislocation, but just a misalignment of the bones. It can cause the cartilage between your vertebrae to bulge out to one side or the other, and that's a whole nother bag of worms. And the other problem that is very common is sciatica, which you may or may not be familiar with. The sciatic nerve, again, I'm going to demonstrate sort of the sciatic nerve runs underneath your glutes, underneath a muscle called the piriformis muscle. And that piriformis muscle is attached to your leg down here and again attached to your pelvis up here. If that little piriformis muscle is overly overstretched or distended, or if that little piriformis muscle is tense and tight and crunched and in knots, it's going to affect that sciatic nerve, right? So those are going to be your main causes of lower back pain. And we'll go on to do some yoga poses that can hopefully help to bring some movement into those areas, release the muscular tension, and get rid of that pain.